afterwards, in terms of the rebuilding and the restoration, if it's done better than it was before, we call this phase development. Not only did they take them back to what they were before, now they're better. They're more prepared to withstand the next event. That's a very, very important phase because, number one, it also means that we have increased their resilience, haven't we? So yes, we had to go in and respond and provide relief. But now, with the next phase, we have been able to increase that hospital's resilience. And that's what I talked about here, which is the development. And we want to move in recovery up to pre-event. In development, we want to exceed their pre-event status. However, when we do look at a condition, even in a patient or in a facility after an event, that longitudinal course doesn't really tell us everything about that patient's functionality. We don't really still have enough information. So we use another method to assess the very, very complicated system that is the human body. How do we get a handle on how a human being is functioning? Well, in the clinical world, we do it by looking at organ systems, don't we? That's the only way I can begin to get a handle on a patient is if I break his entire body down into components and I assess every one of those components. Otherwise, it's very hard for me to really assess their function. So in the body, we have broken it down into the systems. We look at the cardiovascular system. We assess that. We assess it physically. We assess it chemically. We look, at indicators. We look at the pulmonary system. We look at a nervous system. We assess the GI system or the gastrointestinal system, the hematological system, the immune system, the endocrine system, the renal system, the musculoskeletal system, and the integumentary system, the skin system. We do that always when we assess a patient. That's the order of our thinking. System, 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 system. Check it out, check it out, check it out. When we want to look at something as complicated as a human being, as a human body, and we want to look at a society, likewise, the only way we can kind of get a handle on that amalgam of a huge, unwieldy thing of a society is breaking it down into systems the very same way. So we have done that looking at those systems in which the society is dependent upon to keep functioning. And this is true of really almost any society. They need certain systems to stay functioning. And they're indicated here as this being the whole society that is comprised of the functions of a public health system. We have to have that. That's essential to our population survival. We need medical care. Medical care now meaning individual health care versus population care. Patients need health care. People, communities, populations require health care. Even if it's preventive health care, it's an essential component to viability of a society. Water and sanitation is a system we cannot do without in a society. We can't do without shelter and clothing. There has to be that component in society that ensures that there's adequate shelter and clothing for its people. We need food and nutrition. We need an energy supply. We need to have some energy supply. We need electricity. We need power. We certainly need education. Education is a system that is essential for us to have in order to learn, to live, and to grow in our society. We need public works and engineering. We need the social structure also that is provided within communities, the organizations, the supports, the social services, the religions. Those are essential for us as a community to survive. We need logistics and transport for our roads and transportation of goods and services. We need security. We definitely need to know we're safe. We can be assured that we have safety and security. We need some communications system. We cannot live isolated. We're a community of people. We have to be able to communicate. We need systems that support the communication of the population within the community and outside the community. And we need the economy. We need a financial system to assure that we can support and live and grow in this society. So those are the sectors of the society that we all know and have going in some degree or another in virtually any society. So this now allows us to look at how a society was affected by a disaster in a much more logical way, in a much more structured way, in that it's really hard for me to tell you what happened to all of society, but maybe I can tell you for sure what happened to the medical care component. And that's pretty much what we tend to focus on because we are in the healthcare world. That much I should be able to tell you. Or might only be able to tell you what happened with the public health world following the disaster in terms of what happened with communicable diseases and surveillance programs and vaccination programs or that type of thing. Or maybe I'm really just going to focus on what happened with water and sanitation. How did that change? So, and then there are experts in all of these systems that can help us then to evaluate. But the only way we can really even begin to talk intelligently about the effects of a disaster is to talk about it in terms of which part of the societal systems did it affect. And so using these systems, along with the longitudinal phases, we can start to do some assessments and we start to get some information about the situation or the condition. So maybe I do an assessment, I have an assessment exists prior to the event. I know the the medical care system before the event. I know how many hospitals, I know how many clinics, I know how many personnel, I know how many acute care facilities. That's existing sort of information or baseline information I have. And then some event occurs, there's some damage, there's some dysfunction. Now I'm doing another assessment in another phase. But now I have something to compare it to. Again, I'm only going to be looking, likely, me, at the medical care system. Someone else will likely be looking at what happened with water and sanitation, or the transport system, or that. But now I have an assessment, and I can compare it to. And when I compare these two, I can identify what the needs are. I can get to the needs. And perhaps I'll do it again, the same assessment. Now I'll do it at another phase, perhaps this being the relief response phase, or maybe even in part of the recovery phase, looking at the same indicators of medical care function. I'll now do it later on. And that way I can see the changes and the changes in the needs that have occurred and whether or not we've met the needs of that population or community. And the last point about the importance of looking at the society in components, and I told you that, of course, that each of these is associated with some expert system and expert persons within that system. Who's in charge of all those? How do they talk to all of each other? How do they coordinate? And that is the role, the important role that you'll hear very much of when you talk about disasters, and that's coordination and control. Coordination and control is in charge of making sure all of these systems work together. They're responsible for it before an event, and they're very responsible for it after the event. They should have, ideally, the resources, they should have the power, and they should have the mandate to make sure that the functions of these are met, that they can prioritize resources. They're the ones that should prioritize resources in a disaster as to which one of these systems gets the resources. Where are we going to put our money right now first? Where are we going to put our people first? Which one of these is most important to be addressed first? And that's the function of coordination and control, because whoever is here representing these systems, and if I'm here at the table representing medical care system, I'm going to argue that I'm the most important. That my system's the most important. You need to fix me first. You need to give me resources first. You need, and every one of these will have that representative there pitching their case for their resources. And it's coordination and control who's in charge of the whole big picture. In a disaster, this is often the system that gets defeated most quickly. Maintaining that coordination and control of all the systems. Maintaining the proper flow of resources and supplies to the appropriate systems. So, as I just said, most problems in disaster management is that there just has not been the adequate coordination and control. And perhaps it's because there's not been an adequate preparation for the coordination and control, because that is an entity that should exist before an event. So all of the stakeholders within those systems know who's in charge, who will be in charge, who is going to make those decisions. I see. And that's to create a disaster-resistant community by increasing resilience. As healthcare providers, that should be our goal. In any of the other systems within the society, that should be their goal. If we all have that as a goal, I think our emphasis and our actions would probably be pretty different. We also want to reduce morbidity and mortality associated with disasters, don't we? That's where we can have the biggest change. That's where we can have the biggest impact. So I thought I'd spend just a little bit of time then talking about disaster-related healthcare roles, and at the end talk a little bit about disaster-related education and where we are with that. So the roles that are part of any disaster are pretty much are, and certainly any disaster response, are pretty much defined for us by our institution or our organization or our system. If we work in a healthcare facility or hospital, there's an emergency operations plan or a disaster plan that outlines what